As parents trying to decide whether or not to send their children back to a classroom, they are in a dilemma. Channel 3 is getting answers to the questions parents have asked in an effort to help make that decision. Channel 3's Claudia Coco spoke with the chief executive officer at Children's Hospital about COVID-19 in children. What do parents need to know, Claudia?
Cindy, Dr. Charles Woods says he empathizes with parents trying to make the tough decision about school this fall. He says while they're still learning about COVID-19, most cases they see in children are mild.
Definitely get infected with COVID. However, they may be less susceptible on average than adolescents. Young children may be less susceptible than adolescents and adults to the virus.
Dr. Charles Woods, the chief executive officer at Children's Hospital, says there are some things parents should know about COVID-19 in children.
On average, parents can take some comfort that the risk on average is really low for severe infection in their children.
21% of total COVID-19 cases in Hamilton County are in people under 20. Dr. Woods says the way COVID-19 interacts with children is different than adults.
We also know that children on average have milder disease. In fact, many are asymptomatic or have at worst a mild cold.
Dr. Woods says rarely children get multi-system inflammatory syndrome after COVID-19. He points to two different studies that say children might not transmit the virus as easily as adults, but he says it's too early in the pandemic to know for sure.
Are these early studies, early analyses actually accurate? Did we have enough testing? Or is this just reflecting that children on average have milder disease?
Dr. Woods says statewide children's hospitals have a weekly conference call and they're all seeing similar trends.
That we are not seeing huge numbers of children in the hospital with this coronavirus.
He suggests when making the decision between virtual or in-person school to think about your child's risk factors and the risk to the household.
So if your child gets it and brings it home, depending on your other household members and risk factors, there may be some considerations to be taken into account beyond just the risk to the child.
We did ask about pediatric hospitalizations. The Hamilton County Health Department says they only report the total number of hospitalizations and don't differentiate between pediatric and adult. Live in the studio, Claudia Coco, Channel 3 Eyewitness News.
Thank you.